Got it. Yeah, and Linda had approached me about talking about this, and I'll start out by saying that this is a bit of a book report in that although I've been very interested in the microbiome over the years, it's not been a key area of research of mine. But it is, I think, something that that's important. So I will apologize in advance if I can't answer your tough questions. I should be able to answer most of the easy questions, but if it gets into really detail, I will have to punt. So I'll apologize in advance for that. But if we go on to the next slide, Linda, please. And part of the the issue with the microbiome is that this is something that we really didn't have a good grasp on until maybe about the past 15 to 20 years. And the concept here is that we humans have a whole lot of microorganisms that live symbiotically with us. And although we sort of knew this for a while, for many years, for example, if you look at what's in the gut or in the lung, there are microorganisms that are normally there. What did not become apparent up until maybe 20 years ago as technology advanced, because most of the microorganisms, because prior to 20 years ago, one detected microorganisms in the body by doing swabs, nasal swab, gut swab, whatever, and plating things out and see what would grow on like an agar plate, sort of like the traditional way of identifying microorganisms. And a new technique called PCR was developed maybe 25 or so years ago now, and it was applied to different things. One of the advances that occurred with that, it was able to identify a host of additional microorganisms that actually don't grow on agar plates because they're of the way they are structured, but you can tell that they're there based on this advanced technology. And if you could sort of see these numbers here, the genes from these microorganisms far outnumber the human genome, by several orders of magnitude there, and as we've sort of become more aware of this, and now we have techniques that we could sort of see where these various microorganisms are, and they're actually critically important to how our bodies function. Next slide. And you could see that that anywhere you sort of look through. And the key areas where where the microbiome comes into play is where the body interacts with the environment. So you see, mouth, lungs, GI tract, skin, and sexual organs. So those are sort of like the key interactions of humans with the environment. And then on the far left-hand side, you can see a host of different ways that the microbiome can be affected, including diet, genetics, hormones, and industrial exposures, and the like. So, and then on the far right, and you see the various functions of the microbiome, including production of our friend mucus, which is important and part of what we call the innate immune system. When we describe, and I'm sure you're familiar with these terms, but for perhaps the one or two that are not, when we talk about the human immune system, and there are two main components of it, and one is called the innate immune system. And that is sort of the immunity that responds to everything. So, for example, your skin is part of the innate immune system, because if skin is removed, for example, in a burn or some major thing, you are at risk for lots of infections from everything that's out there. So that's part of the innate immune system. In your lungs, there are also actually mucus production is part of the innate immune system. If you breathe in micro organisms, one of the first defenses is to sort of trap them in mucus so they can be spit out, basically. And that can be, and that's sort of, and actually the innate immune system is probably more important to how our bodies fight infection than the other part, which is called the adaptive immune system or adaptive immunity. And this is, although, and this is also important, but I probably is a small. If your innate immune system is defective, you're in big trouble. If your adaptive immune system is defective, there are some things that can be done, but it's but the adaptive immune system basically is how our immunity that is generating immunoglobulins, B cells, D cells. So there's sort of like the T cell mediated immune system, the B cell, and for example, when we get vaccines, part of what is being done is to rev up the adaptive immune system. So both are important. But when you think about the human microbiome, I think it as more related to what we call innate immunity. Next slide. So what happens in the microbiome changes over time. And actually, if you go way back to birth, and there have been interesting studies that look at the difference because your babies grow in a reasonably sterile environment, but they are exposed to microorganisms as soon as they leave the uterus. So if they are born via vaginal childbirth, they sort of adapt the microbiome of their mother. If they are born via C-section, their initial sort of development of the microbiome sort of is more closely related to the nurses that are taking care of them in the postpartum area, and then of course over time. As one are exposed to various foods and other things in the environment, one's microbiome in your gut changes. And as is true in the world in general, when you talk about the microbiome, diversity is good. So the more diversity there is, the better, the better off that is for the system. And as things sort of come into play that may counteract that diversity, including antibiotics, is sort of big, potential exposure. That is something that can change that. And you can see in these slides that there is certainly as children grow, their diet diversifies. And then and as you are eating different foods, you're exposed to different potential bacteria, because there are bacteria in all foods that we try to eliminate the bad bacteria, but that's just sort of a reality of the reality of nourishment. Next slide. So, and this looks at how the microbiome functions in health and disease. So in the blue is health, and you look at sort of any organ. There are normal microorganisms in your mouth, and you can tell this is a British slide because they add an O in front of esophagus, nasopharynx, lung, stomach. Where things can become disjointed. For example, if you look under stomach, one of the bacteria there is Helicobacter pylori, and that is actually normally present in low numbers. But if it's present in higher numbers, it can actually lead to the development of peptic ulcer disease, and that is something that requires some type of intervention. Various medications such as proton pump inhibitors and H2 blockers can alter the microbiome of the stomach. Cavities are related to the microbiome. Periodontitis, anywhere where you have a chronic inflammatory state, anywhere in the body, be it in your gums, which is periodontitis or gingivitis, in your GI tract, in your bladder, or in your lungs, and that is a sign of an alteration, a perturbation in the microbiome. The lung gets a special notice there because there are talks of specific lung clearance mechanisms, and one of the hallmarks of what we have in bronchiectasis is sort of an over activity of this mechanism, which is an incredibly protective mechanism that's part of the innate immune system. But when you get mucus gland hypersecretion, or you get and you get other abnormalities in the lungs, for example, some people with bronchiectasis have very enlarged airways. So then in that case, it's more difficult to clear secretions out. So that's, and that's why in the bronchiectasis and NTM world, that the key intervention is mucus clearance. PrEP devices and the likes, because and the less mucus you have in the airways, the less likely that is to get infected. So that's always sort of step number one when we're dealing with in the world of bronchiectasis. Next slide. I just put this up there to I'm not expecting anybody to memorize the slide, but red is COPD, blue would be a healthy person. You can see that, and that there are different sort of bugs that sort of that are found in COPD as opposed to non-COPD. And you can see how in that bottom left-hand part of the slide that it can sort of sort out. And this is something that we're still learning a lot about. I can only find one or two papers that looked at bronchiectasis or looked at the microbiome of bronchiectasis, and I had that slide later on, but it wasn't too much different, I think, from what we see in COPD. Next slide. So then, going back to the gut microbiome, that there are certain things that can be done to potentially try to get this towards more towards normal. Because anytime you either have dietary issues, or people not eating for one reason or another, so they're getting nutrition via other means, typically intravenous. Or antibiotics have the potential to alter the microbiome. That anything one can done to try to get that more towards normalcy is something that we would like to do. Next slide. So what is the effect of antibiotics on the microbiome? And again, when you talk about microbiome, diversity is good. So the more different organisms you have in there, the better off you are. And one of the things that potentially happens with antibiotics is a reduction in that diversity. So you can see that sort of maroon line down the bottom. And this is related to a number of different factors. Where you are at a baseline. A broad spectrum antibiotic is going to potentially be more harmful than a less broad spectrum antibiotic duration and route. Intravenous, I think, tend to be more problematic than oral. But then after a person stops antibiotics, there is a return towards baseline, but sometimes it may not get all the way back to baseline. So that's some, and then sort of the next round of antibiotic, you're starting at a lower level in terms of this metric of diversity. Next slide. So, what are the things that we can recommend for having a nice diverse microbiome? And in the world of bronch and NTM, people on chronic antibiotics, and we get that. So are there things that we can do to hopefully ameliorate the bad effects of antibiotics? Well, here are some of the recommended tips. And when I went online, and you have to be careful what's out there. There are a lot of sort of groups out there that are trying to hawk whatever supplement they have. So I got this from and this sort of this made sense to me, that that's not sort of, looking at any sort of ones, and there's no magical cure to getting a more diverse microbiome. I think there are a lot of different things, but certainly a wide range of particularly plant-based foods is important to have that diverse microbiome, and a higher fiber diet. So fruits, vegetables, legumes, pulse, nuts, whole grains. Avoiding highly processed foods. And these in general that do a lot of bad things and may be in part behind the increase in obesity that we see in certain parts of the population. And there are certain what are called probiotic or prebiotic foods, including yogurt, and there may be some benefit from them. If you enjoy them, eat them. But again, there's no magic bullet. And there are certain saturated fatty acids that, again, are bad for biologic for microbiome diversity. So, things like extra virgin olive oil or that have those less saturated fatty acids. That for those of you that are on chronic antibiotics, they affect all types of bacteria, both the good and the bad. So anything you can do to sort of increase that diversity, which were the points up above. If you're currently on a lower fiber diet, increasing fiber can cause issues. So if you're making changes, do it gradually and drink lots of water. And that is my last slide. So I'll sort of leave the rest of the time for any questions. As I said in advance, I can answer some questions, but there are some that I may not be able to answer. But I'll write it down and get back to you if I can research and answer.
I think, Dr. Menino, there was one more on the microbiome and NTM. This image.
Oh, okay. Oh, yeah. This was the before the questions, and this was the one slide that I found on a paper that looked at the microbiome and NTM, and I think perhaps the difference there is not only are you dealing with the gut microbiome, but you're also dealing with the microbiome in the lung. That is less important in most people until you get into COPD, bronchiectasis, cystic fibrosis. And that's where the microbiome becomes more important, and then maybe perhaps in a post-pneumonia environment. So that was my last, so you can see, and we want to go more towards health and less towards dysbiosis. And now there's the question slide. There we go.
Well, that's great, Dr. Menino. And if anybody has a question, if you want to raise your hand in the electronic little menu,